All right, so we will continue now with our health beat this morning at 9:29. New research showing right now many Americans struggling with depression and anxiety. They feel that their mental health medication treatment might still be this one size fit all, and it's really not. They want better. So to discuss why personalized care might be the way to go and how genetic testing falls into that space, want to bring on board certified psychiatrist Dr. Crystal Nelson. Dr. Nelson, thanks for joining us here this morning.
Thanks for having me.
All right, so let's set up the big picture here, Doctor. Two-thirds of folks with depression or anxiety, they say that managing their mental health on a daily basis is a struggle. What does that tell you about where we are right now with mental health?
Well, I think that it just tells us that where mental health is such a complex situation and it's highly individualized. We know from that recent GeneSight Health Monitor survey that, like you said, 88% of people said that they would feel more confident if their mental health care were personalized. So patients are feeling like this is a one size fits all, when in fact it's the exact opposite. It's not a one size fits all. Personalization really matters. We know that treatment outcomes, medication, side effects, symptoms, all of this can vary so significantly from person to person. So we want to be able to tailor these treatment plans and have informed conversations so that we can just get overall better treatment experiences.
Why has it been so difficult then to move beyond this model of trying to find the right medication and being a one size fits all?
Well, the current approach that we have for mental health care is a frustrating, long, usually a trial and error process. We know that about only 13% of people treated for depression and anxiety that had previously been treated said that the first medication even worked for them. And so now what we have an opportunity to offer patients is a test, a pharmacogenetic test like GeneSight, where we can have a clinician order a test where they can do this in the office and get information back about how the how their genes might actually impact the medication outcomes, hopefully cutting down on this long trial and error process that we have had and create a much more personalized approach to their healthcare.
What are the concerns then when it comes to genetic testing and mental health, although it might cut down some of that process, like you said, trial and error?
I think the overall concern, if there is one, would just be ensuring that the patient and the clinician are on the same page. It's really important that patients have open and honest conversations with their clinician and that a patient find the clinician that is the best fit for them. If this is something that a patient is interested in, they should make sure to have this conversation with their clinician. If they don't have access to that, they could go to the genesight.com website and find a local clinician that might be best suited to order pharmacogenetic testing for them.
All right, and then when you do have that conversation with the doctor, what are some of the specific questions you should be asking them?
Well, one, if they are comfortable with this test, if it's something that you are interested in ordering. Also, I think it's important that a patient just share what their experience has been, more so giving information, sharing how they have had experiences in the past with other medications that may or may not have worked, just being open and honest. The patient and clinician relationship should always be a collaboration.
Yeah, agreed. What else should we know this morning before I let you go?
Well, I would say for more information, again, patients can go to genesight.com, and any patient that is dealing with a mental health condition or they think they may be dealing with a mental health condition, please be open with your clinician, whether it be your primary care provider or your mental health care provider, about what's going on. Do not suffer in silence. This is Mental Health Awareness Month, and we want to make sure that people feel comfortable getting the right care.
All right, great message there. You got to advocate for yourself. Look out for number one. Dr. Crystal Nelson, board certified psychiatrist, appreciate your time this morning.
Thank you so much for having me.
Thank you.